we do in life echoes in eternity.
Yeah, yeah.
And I think, like, I'm going to bring it back to culture, like in a huge El Paso thing. Culture is like some men, no, I'm good.
Mm.
But I think one thing that people need to realize, like, when you're with your doctor, whatever you say to your doctor is protected. You can't say it to outside and no one will know. And I don't want people to understand, like, talk to your doctor. He's not, he can't tell anyone.
No.
And it's that confidentiality, but you can do a better job when people are honest with you.
No, definitely.
And I think some people, like, they're scared. Oh, I can't tell my doctor.
Mm-hmm.
Like, oh, no, I'm good. And I think we have to step back and be like, you can treat it or you can get the right blood work done, but you can't do your job unless you're honest with your doctor.
Well, if the patients are not honest and they don't tell me really what's going on, I'm not a magician. I'm not going to be guessing what's happening. So definitely, when the patient is honest, it makes our lives easier. We can provide better care. And definitely, like you mentioned, there is a law that is called HIPAA that we have to follow. And it is illegal. We can get in trouble, actually, and fined, if even worse than fine, if we share information from a patient that is not giving us permission to share that information. So also, we are very proud of being able to ethical when we practice medicine. And it's very unethical to be telling other people about my patients' issues or concerns.
Yeah. So, I think that's really good that, like, you're one of those doctors, you've listened. And I have a couple of friends that they've had questions like, you know what, I can't help you. And I send them, I don't know what they tell you, but, and they have good results. And, like, having that open conversation, because some doctors, they don't have that. They're very scared to talk to their doctors. Mm-hmm. And I like that about you, that people can talk to you and you'll be like, and I think, like, people do things the wrong way and then there's side effects. Mm-hmm. I think some people, like, I think medical MD, probably one of the worst things that out for people. They read a little information. I was like, I'm going to treat it. I'm going to go to Mexico and get medication from Mexico. How often are these, like, people getting, like, either black market drugs or even medication from Mexico? How does that affect people's health?
Well, going back to hormone replacement therapy, testosterone replacement therapy, it is very common in our culture, in the fitness culture as well, that people are using testosterone. They do feel decreased sex drive or fatigue, and they think that their testosterone is going to be low, and they start using testosterone in the black market. Also, people that they do have high sugars because somehow they check their sugars and they start taking medication for diabetes that is not prescribed. And that is also dangerous. There is medications that can be prescribed if other labs are normal. For example, metformin, which is a very common medication for diabetes. If the kidney function is not very well, it can give you problems. So we have to stay away from metformin. If your kidneys are fine and you tolerate metformin, you can take metformin, but it's something that a professional has to decide for you. Going back to testosterone replacement therapy, the issue is that if your testosterone levels are normal and you start using testosterone replacement therapy, supplementation, or steroids, there is a negative feedback, mm-hmm. and there is a risk. If somebody starts using hormones, steroids, or testosterone replacement therapy for quite some time, there is a chance that when they stop using it, their gonads are not going to produce testosterone anymore, and they're going to become dependent on it. Not only that, but I've also seen a lot of patients that they have low testosterone, they get their labs, and they don't want to go through the normal process and get the prescription from the pharmacy, or that their testosterone levels are maybe normal, in the low end of normal, and it's not ethical for me to prescribe it, but they want to have higher numbers, and then they do go to the black market and get those testosterone compounds. And then I've seen plenty of times where these products might be contaminated. I've seen infections, abscesses in the site of the injection. And another thing that I've seen a lot is that these patients are on testosterone from the black market, and they go back to get their labs checked to see if their testosterone levels are normal. And when they are in high dosages of these medications, even if it says pharmaceutical grade, but it's not from the pharmacy actually, you can see on the labs that it's completely fake because their levels are not getting any better. They are not higher, and I've seen them even lower after using this black market testosterone.
Yeah, I think a lot of people are too trusting because sometimes the label looks nice or they put it in a nice box. And I've some people say, oh yeah, it looks pretty. And I'm like, well, yeah, or their coach or their trainer. And it's like, oh, okay, I think we need to be careful with it. And I think, like there's just so many people, there's so many different things. I think like one issue I would like to talk about is like the use of antibiotics and people just like hitting, like they get sick and I'm going to take like these. How is that a problem in El Paso?
It's a big problem. We have Ciudad Juarez right across the bridge, which is very easy to get access to medications from Juarez. A lot of people, they do have a little bit of a sore throat and they start taking antibiotics. The issue with these is that sometimes these sore throats can be viral. They don't need an antibiotic. And when we start using antibiotics for not actually necessary reasons, we can create resistance to these antibiotics. And when the patient actually needs the antibiotic is not going to work for them because they have been taking it for so long or so many times that they create resistance. There's also antibiotics to treat different type of infections. Some antibiotics for a urinary tract infection are not going to work for a throat infection or a sinus infection or a pneumonia. And I've seen patients that go to my clinic because they have a UTI or they have, sinusitis, sinus infection, and they have been taking an antibiotic that is not going to do anything for a sinus infection. So it is a big problem.
Yeah, I think a lot of people in El Paso play doctor, and it's like, it doesn't hurt to go see you, get your labs checked, and then, it's like trying to the way I see it is like trying to kill a fly with a bazooka. Yeah. You might get the fly, but you're going to destroy so much things in the process, and you can mess up your...
Definitely that too. I mean, you're going to destroy your normal flora, your normal bacteria in your stomach, in your intestines, and that can cause also gastrointestinal infections, diarrhea. In females, they can also destroy the natural flora in the genitals, and they can create vaginal infections, yeast infections, so many other complications from using antibiotics when they're not necessary.
Yeah, I think that's just a huge thing because I think especially during COVID, I think people were probably taking high amounts of antibiotics because people were scared of COVID, and it was like, well, that doesn't do anything for COVID. And I think COVID's still around and people are still have that fear, and I think and the availability. And I think it's just, pay the extra money to go see you. And so that way things don't get out of hand and you don't end up in the hospital.
Definitely. Yes.
And I like, I'm going to go completely on another topic because I just really think it's a really important thing. I think diet's really important. If you notice, Dr. Patterson is very built. He has a lot of muscle. And one thing I love and respect about this guy is he always keeps on trying to educate yourself. And so you do like some intermittent fasting. And what is your diet like right now?
Well, I do try to eat according to my weight, maybe about 200 grams of protein a day. And I try to keep it low on my carbohydrate intakes and fats. I don't measure specifically my meals, but I try to keep maybe about 200 grams of protein, maybe 150 to 200 grams of carbohydrates, and from 20 to 40 grams of fats. So depending on my schedule, it might be 3 meals a day, 4 meals a day. But I do, like you mentioned, I do like to do intermittent fasting, where I will go 24 hours without eating, just water. And believe it or not, that is so helpful. Let's say if I'm having digestive issues because I'm eating, so much food, when I do my fasting, my gastrointestinal system feels great. And there is a lot of pros about intermittent fasting. You produce more growth hormone, and it has an effect on muscle sparing. A lot of people are scared that work out, of course, that lift weights of doing intermittent fasting because they're not getting their protein that are necessary for muscle growth, but because of the maybe 200-fold production on growth hormone, it's going to prevent you from losing muscle. And of course, because you're not consuming any calories or carbohydrates, you are going to use your energy from your energy sources are going to be from fat, so you tend to burn more fat and stay leaner. And there's a lot of other health benefits to intermittent fasting as well, not just for your appearance, but also for your health. One of the issues that we were talking about was diabetes, pre-diabetes, which can be hereditary, but also dietary. And how it develops when it has to do with your diet. Well, when you consume high glycemic carbohydrates, sugar, sodas, which has a lot of sugar, sweets, a lot of desserts, then your body has to respond to those sugars that you're producing, and it starts producing more insulin spikes more frequently throughout the day. And because there is so much insulin production, then your body starts to develop insulin resistance, where it's not using that insulin as good as it should. So definitely when you decrease the amount of insulin that you're producing throughout the day, such as in a good diet that is not high in the simple sugars, also intermittent fasting, well, there's not so much insulin production, so your receptors and your sensitivity is going to increase, so you're not going to have insulin resistance.
I mean, I think that's really cool. Like, you know, like you need to, how you educate yourself, and you don't need certain things. I think one thing I really came to my head, your father, and you're like a great father, is there any foods you will not allow your kids to have?
Yeah, I mean, I try to tell my kids not, or have my kids not to eat too many sweets and sugars and sweets, because definitely that can create childhood obesity and also risk factors in the future. Just basically that. I mean, fried foods, I try to minimize on my kids as much as possible, and also the sweets. My daughter, she turned 5 yesterday, actually. One of my daughters, I have to, and she hasn't had a soda in her life. So yeah,
I think that's really important. Like, you know, like if you wouldn't give it to your child, you know, like that already tells you, we already know it's bad. Mm-hmm. You know, and I think people, like, it's so common for people to be drinking sodas, and I think sodas are more dangerous than beers. I think there are more people, more complicated. Like if you look at the hospitals, there's more people in the hospital because of diabetes than alcoholic cirrhosis.
Yes, but also alcohol is a carbohydrate, and it's a simple carbohydrate. So people are diabetic and they do drink a lot of beer, well, they're going to have their sugars out of control as well. But definitely, there is less liver cirrhosis than diabetes. But liver cirrhosis is pretty big in El Paso too.
They're both horrible things. I just think we've just gotten so like used to soda that it's like, oh no, it's okay.
Yeah.
You know, but if I was to be walking around the street with a beer, people would be like, okay, you're kind of crazy, you know? But if I was to be walking around the hospital, like anywhere with a soda, it's socially acceptable. And just because it's socially acceptable doesn't mean we should be doing it.
Exactly.
You know, and sometimes it's hard because I think it's like people are just, let's live a little. Mm-hmm. And it's like, well, no, you take that soda, you're going to live less.
Yeah.
You know, and it's not one soda's going to kill you. It's not 2 sodas that's going to kill you. It's the habit of drinking the soda.
Definitely. I mean, if you can have one once a month, maybe, it's not going to hurt you. But it is difficult, of course. You have one, and then you have 2, and then you have one every day, which is going to give you problems.
Yeah, and I think when you go to the store, you can't buy. I mean, you can buy one soda, but it's like, oh, well, it's like $1 more if I get a 12-pack comparison to. And I think with the economy, it's like, oh, well, it's just cheaper, and it's like, well, it's not cheaper because it costs.
Yes.
You know, if you like soda, drink it. That's cool, but everything comes with a cost. Yes. You know, and we have to look past it. Sometimes I think it's like it's okay to throw away those foods. Yes. You know, I think El Paso culture, it's like, finish your food on your plate. Hey, you know what? If you're pre-diabetic, if you're diabetic, don't make your family members eat that cake, or, just let them chill.